usually the patients who come to us with hip pain tend to be younger, and that happens so because in our country the problem of hip affection is mainly because of avascular necrosis. So avascular necrosis itself is a condition where the blood supply of the hip joint is cut off, which can lead to the cartilage damage in the hip itself. So when the blood supply to the cartilage is taken away, the support for the cartilage, which is a glistening white tissue which allows your joint to move freely, is gone. And once the support or the foundation of that cartilage is gone, the cartilage becomes irregular, and then the irregularity causes rubbing on the surfaces, leading to friction and pain. Now, majority of the cases of avascular necrosis don't need immediate surgical treatment. We tend to give them medical management. I tend to reassure them, telling them that this is not a horrendous disease, it can be controlled, and in certain number of patients who have arthritis, we can make them completely normal by performing a hip replacement surgery. One of the commonest reasons is to take too much of alcohol to drink, and chronic alcoholics tend to have this problem of cut off of blood supply from the hip joint itself, which leads to a condition called as avascular necrosis. Usually happens at a very young age. Patients who take steroids for a long duration also will have avascular necrosis issues. Recently, in the last 6 months, we've been seeing tremendous increase in the number of patients presenting to me with avascular necrosis. And there is somehow an association with patients who had severe COVID, were admitted in the hospital, received steroids. So it could be a combination of COVID as well as steroids, which is leading to some patients developing avascular necrosis at an early age. Another reason for young patients getting arthritis in India is inflammatory arthritis like rheumatoid arthritis or ankylosing spondylitis. These are the reasons why patients come to us earlier with hip pain. We also tend to see some very young patients who suffer from what is called as a juvenile chronic arthritis. What does that mean? These patients at a very young age get inflammation of their joint and destruction of the joint cartilage, leading to arthritis at an early age. They tend to have severe pain, they are crippled, walking is difficult, and in certain cases when the medical management of this condition is over and the patient's symptoms don't improve, we suggest them to have a hip replacement surgery. And we've done hip replacements as young as 13 to 14-year-old children, and they've had excellent results and they have gone back to normal activity following these operations.